Hello everyone, and I'm very happy to have with me Dr. Ankit Arora, a proud Damzonian, and he's done amazingly well in November AIIMS 2018. He's secured rank 23.
Thank you, ma'am.
Awesome performance, Ankit. कैसा लग रहा है?
Believe ही नहीं हो रहा था पहली बात तो. The day the result came, I didn't sleep. I didn't want to sleep.
Yeah, you're so excited and happy.
Yeah.
You totally deserve it, and it's like a lot of hard work, and and it's like a dream come true. So I congratulate your parents as well for giving you the kind of support that you need.
Yeah. The parents, they are very important for these exams.
Definitely, yes, definitely. And Ankit has been an early starter, and he's been with us right from his foundation years. He's done a foundation classroom course, and then he's followed that up with TND. And the entire purpose of the interview is, to help the juniors to plan their strategies once they listen to the top rank holders. And they'll be very, very motivated when they see these videos. So Ankit, I'm sure Sare juniors, they really want to know from you that when you joined early on in your foundation years, what was in your mind? What was it getting a good set of concepts, a good set of notes to prepare you for your internship?
Ma'am, I joined DAMS Foundation in my 6th semester, when third year when everyone joins it, so I joined it.
Okay.
But I think the benefit was at that time I made notes at that time for most of the subjects. Not all of them. Right. Like I did not make notes for I missed radiology for at that time. Okay. But and also some other subjects I missed. But I made sure that for most of the subjects I had my own handwritten notes at that time. Okay. But when I started to study after my internship, I made sure for most of the subjects I had my own handwritten notes. Okay. So. Because in photocopy I had to open the book at one side and open the notes. So it's
and you never get the concepts, right? Yes, so once you are in the class and you listen and you make your own set of notes, you.
But for first and second year I read photocopy notes only, but
okay, but then you had to do the hard work for it from the textbook itself, right? Okay, that's great. And मुझे ये बताओ, in the internship when you were doing your TND course, आपकी तब क्या strategy थी?
I did the TND after my internship.
Okay.
So I joined the TND. The first batch itself I joined because I wanted to start early. Early. 4th Jan. I remember the first class was on 4th Jan before the NEET exam. So I joined really early, and I made sure that in that 1 week I completed the syllabus at least from my notes, and I also practiced the MCQs also at that time in that 1 week. And that's all. And then after. And
were you consistent in giving the test? And did you follow the schedule given to you? Yes, because that's something that again students get confused about.
I made sure I followed the TND schedule completely, because it is very difficult for me to make my own schedule. So I followed the TND schedule, and according to the TND finished on 23rd August, and my syllabus also finished at that time. Last class I remember was gynae. Right. And that my syllabus also finished at that time only.
Wonderful. Yes, okay. And फिर से आपने अगस्त से revision start किया था. Okay. And आपकी revision की strategy क्या थी, Ankit?
I wanted to complete my first revision till the CBT exam.
Okay. So you kept your first target as CBT.
Yes, ma'am. But I was not able to complete at that time, and I completed approximately 15 days after that. Okay. So, but till CBT, I did most of the subjects, and but I did not perform really well in CBT. So I had to.
So did it give you an insight on what you need to focus on and what you need to revise?
Yes, ma'am. I got in PSM I got biostat questions wrong.
And that's really important for AIIMS as well. I
was not getting that right at any time. So I watched the mop-up videos on e-medicos or biostats. Okay. And I made sure that I get these biostats questions right.
Correct, because it's really important for AIIMS.
So and luckily in them 3 questions came from
exactly, that's what I said. So do you think that the mop-up videos were of good quality and they helped you to...
Yes, ma'am. I watched mop-up videos of psychiatry. Yours videos are very good, contraceptive videos.
Yes, and again you did get a lot of questions, at least 2-3 in both AIIMS and PGI, they do tend to ask, right?
And that biostats mop-up videos are also very good.
Okay.
Yes, ma'am.
Great. Acha, and Ankit, मुझे ये बताओ, when you prepare for TND, it's like a subject test,
Yes,
right? So बहुत सारे बच्चों को ऐसा लगता है जो first test हुआ, we would have forgotten that, and then the new test is coming up. Then when will we revise? So I want to know from you, number one, when did you start doing the grand test? Because those are like the mixed bag questions. It's a 300 MCQs score, you know. So वो कब किया, and how did you plan the revision for the previous subjects?
Grand test, I started doing in Jan itself, because I remember in the first.
So you started right in the beginning itself.
Yeah, first, I remember the first TND of Tushar sir. He said the difference between rank 1000, and he also makes stories, and he said two students came to me, and one was rank 1000, one was rank 200. What was the difference? They said ki 201 said I practice grand test regularly.
Yes.
So I made sure I did grand test regularly, and the first grand test I gave on 30th Jan.
Okay, so you remember the date as well.
Yeah. I remember that I got 130 questions right at that time.
Okay, out of 300.
Yeah.
Yes.
And last grand test I gave was 1 week before AIIMS.
Okay, so even 1 week before AIIMS views. And what was your performance in that?
At that time I got 198 questions right.
That's a huge improvement. Yes, so did you see your consistent improvement, right?
Yes,
you said you started with 130 correct questions, and you then went on to 198, which is a very safe zone. Once you reach 200 correct MCQs, you are in a safe zone, and you've quite replicated that thing in the AIIMS exam as well. So Abhi, this is something that I would really want you to tell your juniors. What was your strategy after giving the grand test? Because a lot of students would ask us that, you know, once they reach a level, they're not able to improve their correct questions, and they keep doing more negative. So how do you know, how did you go about it?
Ma'am, after giving grand test, I used to watch the videos also.
Okay, the video discussions that are there, right?
The questions I did wrong, I used to watch the videos also.
Okay.
And the important thing is you should know that where you are going wrong.
Right.
That like my opta was weak, so
that's called as a, you know, assessment of your weakness and strength zones.
My micro was very weak, so I did performed very bad in micro.
Right.
So last 1 to 2 weeks I was revising these subjects only. Micro
and again you did get a lot of micro in the exams as well.
Yes, ma'am.
So did you keep an analysis chart on what subjects you're doing wrong? And
no, I didn't keep any analysis, but I used to see it is very easy on the app, so you can open the review.
Yes, it's the analysis is almost out there for you, right?
So I could see where there are more reds.
Right.
So I could focus.
You used to focus those.
Yes,
okay.
And
what about the revision of subjects which have already been covered?
Yes, ma'am. That when there is medicine and surgery TND,
okay,
that is approximately 7 weeks.
Right.
So I don't think you should study medicine and surgery for 7 weeks.
Right.
Because not many questions come, but it is not worth 7 weeks.
Yes.
So at that time I used to do other subjects as well.
Okay, so you used to divide.
TND,
so you used to revise some other subject in between.
Yes, like with medicine I used to revise path and pharma.
Right.
And with surgery I used to revise anatomy.
Okay.
Yes, ma'am. At that time.
So you used to make coherent subjects and revise those intermittently.
Yes, ma'am.
Perfect. Acha, and then I want to know CBT se lekar up till AIIMS. Then what was your strategy?
Ma'am, in CBT I performed really bad, so I studied a lot for 15 days.
Okay, so it gave you the real push that you needed, and I'm sure now you would be thinking that it's good that you sort of landed up there.
2600 rank in CBT. So
okay. So from 2600 to 23 is like you know, really focused on the right things close to the exam.
But only it was only for 15 days, but after 15 days I had read all the remaining subjects.
Okay.
So it gave me a push to finish my syllabus at least.
Right. So now since you're saying that you used to do a faster revision close to the exams, because that is what is required. So what did you rely upon close to the exams for your revisions?
Ma'am,
was it more of notes or was it more of questions? What was it before the exams?
Ma'am, it was a mixture of both, I think.
Okay.
But more of notes.
More of notes.
Yes, ma'am.
Right.
Basically, like before AIIMS exam for before 10 to 12 days, I studied only first and second year
Okay.
And a little bit of Gynae and
So
PSM.
yes, because those are the most important ones for him. So basic sciences, PSM and OBGY, right?
Yes, ma'am.
Okay, great. And then if we talk about 1 week close to the exam, how did you plan the revision during that time? Because now, you know, NEET is coming up and a lot of students want to know how to plan their revisions in a span of months' time. So what would you suggest again? More of notes or more of question practice?
I think more of notes at that time.
Yes.
Because notes and questions are going to come from notes only. So
right.
I think at that 1 week before, go back to class notes. Not even TND also. TND is I think a little bit on the higher side for last 1 week.
Yeah.
But for last 1 week, go back to class notes.
Yes, ma'am. Right. Okay, that's great. And something about the strategy in the AIIMS, you know, when you go for the exams, those 3 hours, can you highlight something on how to rule out things, or what was your strategy during the exam?
Ma'am, I think during the exam, it comes with practice, like by giving grand tests.
Yes, so since you have been giving it right from January,
yes,
it just seems like another test to you.
Yes, ma'am. By giving grand tests, you see new questions. Like when I had not read Optha and PSM, I was still doing the questions.
Right.
So at that time, but I had to solve the question, so I had to find an answer. I had to rule out. So you learn.
You learn the technique, and,
yes,
and you learn more and more content as well. So
yes,
that helps you in ruling out. That's great. And you know, through the eMedicos app, we're trying to give you a lot of material. Like we did give you the last 3 to 4 years AIIMS papers solved. Then we gave you the mop-up videos. So did you use the app to help you in preparation?
Yes, ma'am. I watched the mop-up videos, and I did 1 or 2, I think 3 papers last year.
Last 3 papers
of AIIMS.
Okay, that's wonderful.
Yes,
and I would want to know that how did you use the club, because we used to give all the new updates in the club as well by the faculty to help you stay updated with the information, and and could you ask your queries in the club, and how did you use the club as well?
Ma'am, I was not very active on the club.
Okay. So
I didn't ask any queries.
So you were a passive reader.
Yes, ma'am.
Okay.
I just used to search for the if any doubts.
Your doubts, right?
And it came up most of the time. It came up.
Right, has been already asked by someone or the other and has been answered by the faculty.
But I was very active other ways. I was seeing the club mostly
on the passive side.
But
so yes,
before CBT, like 1 month, I didn't see the club.
Right.
But after the CBT, I used to
again you used to look at it. Wonderful. And you know, can you give some last minute advice to your juniors who would be looking forward, you know, to know that they can also do it, and it is possible to get a good rank in central institutes as well?
At the last minute, you have to do what you were doing wrong. Like you can see the wrong questions you have done in the grand test or SWTs. And like my weak subject was micro, so last day I was reading parasitology and all this, and it came in the exam.
Right.
And
so you know, it's very important to know your weak zones, because only then you can improve from your you know, current level. So if you have to go beyond where you are, it's important. That's what he's been consistently saying, that he used to keep looking out for what he's doing wrong by listening to the videos or going back to the notes. And would you call yourself more of an MCQ doer or more of a notes reader to crack these exams?
Ma'am, I would call myself as a test doer.
Okay, so you used to
practice
give the grand test.
Yes, ma'am, grand test.
Great.
And notes also, I had notes also, but notes and grand test, and SWTs I gave for a few subjects, not all, but a few subjects. I thought I had saved them for
towards the end
for NEET exam.
Okay.
But grand test, so I thought that I was short on grand test.
Okay, so because you were giving them so consistently.
I still have one grand test in my account for the before NEET. I had saved before NEET.
Perfect. So let's wish you all the very best for your future, and I hope you do really well. You know, and congratulations once again from the entire DAMS team, and we wish you all the very best.
Thank you.
Thank you.